Foundations of U.S. Healthcare Delivery by Professor Tammy. Foundations of U.S. Healthcare Delivery, Part 1.
Beliefs, values, and health. What is the difference between preventive services and curative health? Preventive services is when you help someone avoid being sick. Well, curative health is when you treat someone from a disease. Curative medicine has decreasing returns in health improvement with increased healthcare expenditures. That means when you're trying to cure someone who is sick already, sometimes a person doesn't always feel 100%. And it costs a lot of money. Let's just say, you have the mask. How much does that cost you if you wear it? I know sometimes it's inconvenient, but how much does that cost you to make a mask or to purchase a mask? Worst case scenario, you become very sick and you have to go to a hospital. How much would that cost you? Even if you have really great health insurance, it does cost a lot of money too. How much will be paid back into healthcare? Whether it's through personal or society or both. Promotion of health and preventive benefits for society. When you do promotion of health and prevention, try to get people to stay healthy. This helps people learn and become more educated to prevent or delay diseases. Strong forces work against fundamental changes in the financing and delivery of healthcare. Think about what the strong forces might be. No tax-financed national healthcare program. Why do you think the U.S. does not have a national healthcare program? Do you think we should? Or should we have a mix? Social norms explain how we view illness and expectation. How do you view it when you get it? How do you view illness? Especially when you get it. Are you strong? Are you weak? How about when a family member gets sick? How about when a stranger gets sick? What are your opinions with both? What are your emotions, your feelings with both? How about when you had to pay for someone else's medical bill? How do you feel about that? Recently, societal values have shifted to a social justice mindset. The way we think about healthcare has changed over the years. And also, think about it. If you get sick, should society also help you pay for some of the bills? It's also the reverse. When someone else gets sick, should you help them? What is health? Health is medical, biomedical model focused on absence of illness and disease. So it's about being well, not sick at all. In medicine, there is emphasis on clinical diagnosis and medical interventions to 1. Treat disease or symptoms when someone is sick. 2. Have a clinical diagnosis and medical intervention when someone is sick. So you notice this is more about curative versus preventive. Optimum. Optimum means the best. Optimum health exists when 1. A person is free of symptoms. That means they're not sick at all. A person does not require medical treatment, medicine or any other, medical technology stuff. So when someone is in optimal health, does that sound awesome? So I have a quote here from the Society for Academic Medicine. A state of physical and mental well-being that facilitates the achievements of individual and societal goals. So it's the goal of the individual and also society. And it's not just physical, it's also mental well-being. Biopsychosocial model of health. WHO, World Health Organization. That's an international health organization, which you might have heard very much recently. WHO definition of health is a complete state of physical, mental, and social well-being, not merely the absence of disease. It is not only the physical body, but also the mental and sociological health of the person or people that gives health more dimension. So when you think of dimensions of health, it's not just physical, it's also mental, social, emotional too. WHO defines a healthcare system as all activities with the primary, that's the main, primary is the main, purpose to promote, restore, or maintain health. So it sounds like it's all going back to getting better 100%. Holistic health treats the whole person, the whole well-being. You're thinking of it like everything, physical, mental, social, and spiritual too. Holistic health incorporates alternative therapies. Sometimes you might hear alternative therapies as complementary medicine. So sometimes you might hear as one name or the other. Literature shows that religious and spiritual beliefs has a positive impact on overall well-being. It affects the incidence, experience, and outcomes of common medical problems. Think of traditional medicine and or having family support. Do you think you will feel better if a family member or a few family members looking and understanding you when you are sick? It's just someone to look after you. Knowing that someone is looking after you, or even someone who understands your culture and traditional medicine. So, sometimes when you say, oh, this person speaks the same language as me, but does that person also understand your culture and your belief, whether they believe it or not, but do they understand? And how your culture behaves around those who are sick. Illness and disease. Illness is identified by a person's perception and evaluation of how he or she is feeling. This is subjective, so illness is subjective. Illness is how a person sees themselves and how they are feeling. Disease is based on a professional evaluation. It is more logical and objective. This will involve lab results and how the medical team diagnose you. So just think you have proof with disease. With illness is how you feel. It doesn't always mean there is proof, but how you feel. So let's go further. Possible to have a disease with feeling ill or feel ill without having a disease. So yes, of course, when you think about, are there times you're sick but you don't know it? That's asymptomatic. And sometimes when you feel sick but are not sick. So sometimes someone who has the diabetes disease may not feel sick, but the glucose test shows that their sugar level is high. Sometimes you wake up feeling horrible, but you don't have a disease. So these things happen, like I have an illness but no disease. I have a disease and no illness. Sometimes that does happen. Disease classification. There's acute, subacute, and chronic. Let's first talk about acute. The disease is very serious. It's very serious. It's episodic, of short duration. That means it only takes place for a short period of time. It's often treatable. It's not 100% treatable, just often treatable. For example, like myocardial infarction and lack of kidney function. So let's talk about chronic next. That's the third one. That's when the disease continues. It's less severe, but it's long and continuous. It keeps going. So some of the disease that can be controlled but can lead to serious complication is asthma, diabetes, and hypertension. So these things don't go away. You continually have them. So the third one, the one in between, is called subacute. It's between acute and chronic. So subacute has some acute features like it's severe. And it's also post-acute treatment after discharge. So like head trauma or ventilator. So think of acute is very severe. Chronic is continuous. And subacute is in between. Quality of life. Think about what is quality of life to you. What would make you happy and comfortable in life? What are your desires about being happy and healthy? What would make you happy and comfortable as a healthy person? Term used in two ways. One, an indicator of individual satisfaction with the experiences while receiving health care, such as comfort, respect, privacy, security, autonomy. And two, overall satisfaction with life and self-perception of health, especially after a medical intervention. The goal is to have a positive effect on an individual's ability to function, meet obligations, and feel self-worth. So you feel like, yes, I am worth it. I would like you to watch this Steve Jobs life speech. Rumors have written that Steve Jobs wrote this, but it may not be true. I thought it was beautifully written whether he actually wrote it or not. So, as it says, I reached the pinnacle of success in the business world. In others' eyes, my life is an epitome of success. However, aside from work, I have little joy. In the end, wealth is only a fact of life that I am accustomed to. At this point, laying on the sickbed and recalling my whole life, I realized that all recognition and wealth that I took so much pride in had paled and become meaningless in the face of impending death. In the darkness, I look at the green lights from the life-supporting machines and hear the humming mechanical sounds. I can feel the breath of God of death drawing closer. Now I know when we have accumulated sufficient wealth to last our lifetime, we should pursue other matters that are unrelated to health. Should be something that's more important. Perhaps relationships, perhaps art, perhaps a dream from younger days. Non-stop pursuing of wealth will only turn a person into a twisted being just like me. And you can also click at the link above if you want to hear him say it. See you soon. And remember to read the book.